Hi everyone. In this video, I will be discussing the scope of dentistry and job opportunities available after getting your GDC registration, which can be after completion of a BDS degree from a UK or EU recognized university or after passing the ORE or LDS exams. Make sure you click the subscribe button and share this video with your friends. First of all, I would like to explain the structure of dentistry in UK. There are mainly two different types of dental services, primary care and secondary care. I will start with secondary care and we will discuss primary care dentistry pathway later on. And hopefully all your questions will be answered by the end of this video. Secondary care services are provided in hospitals by a referral system. If a dentist has a complicated case which is beyond their skill set, it can be referred to secondary care centers where all the cases are triaged, and if it meets the referral criteria, the patient is then treated by appropriate specialists. Mostly jobs in hospitals are for senior house officers, staff grade officers, and consultants, usually in oral surgery, orthodontics, and a very few in restorative dentistry. You can apply for these jobs through a temporary registration route. Temporary registration is only valid for 5 years, and you will have to do ORE or LDS afterwards if you want to continue to practice. In secondary care, you are paid a fixed salary with some bonuses if you do overtime work. Recruitment for secondary care services is done by the NHS Jobs website and hospitals only, links to which are in the description below. Now let us discuss about primary care services. These are divided into National Health Dentistry Service and private dentistry. Most dental practices provide a mix of both and are called mixed dental practices. National Health Service is contract-based, where you are provided with a dental contract and provision of dental services is done through that. You are paid by the NHS according to the amount of dental activity you do. At the moment, the current system is based on UDAs, which stands for Unit of Dental Activity. The amount and rate of UDAs are agreed between you and your employer. If you have an enhanced skill set and can offer specialist services, it is possible to work in both primary and secondary care simultaneously. To work in NHS primary care services, you will need to have a performer number, which can be obtained after your registration with the GDC. Remember that the performer number and GDC numbers are different. There are two ways to obtain a performer number: dental foundation training and performer list validation by experience, or PLVE. DFT or dental foundation training is a 1-year structured training program and open to all dental graduates, but preference is given to UK graduates as they do not have any other option to join the performer list. It is a very competitive process as a lot of students apply for it, and it involves interviews and assessments. Recruitment for DFT is done through the NHS Central Oriel system, usually in September. There are situational judgment tests, 2 or more OSCE stations, which are around 15 minutes each as part of the assessment process, and there are multiple interviews. If you are lucky and are offered a place, then you will be working in an NHS dental surgery under an approved trainer for 1 year. You are paid a fixed salary and you are not paid for any other private work you do. This program is funded by Health Education England and the NHS. It is a structured training program where you have allocated study and practice days. You have to log all educational and training work on an online e-portfolio. For overseas students, the other pathway available to get a performer number is to undertake PLVE. This used to be called Vocational Training by Equivalence (VTE) and Foundation Training by Equivalence (FTQ) in the past. It is also a one-year training program where you work in a primary care dental practice and have to complete a portfolio for assessment by a health education deanery. You will also have to attend some mandatory NHS courses conducted by the deanery as part of the PLVE training. The PLVE curriculum is exactly the same as DFT. However, it is not salaried or funded by the deanery. The dental practice pays you like any other dentist on the basis of a UDA rate and a percentage of private work done. The UDA rate is slightly less than average. There are some costs which you need to bear in mind, like paying for your assessments by the deanery and paying a fee to your mentor for training. This is either done by salary sacrifice or some practices pay the mentor themselves, and you do not have that burden on you. The PLVE is a long process and it takes around 1.5 to 2 years in total to get through it all. Many dental practices have PLVE opportunities available. If you do not want to work in the NHS, then you can opt for the private dentistry route, which does not require a performer number and hence no training. You're usually paid as a percentage of the work you do, around 40 to 50% of the patient payment after some deductions. For students who have just cleared ORE and LDS or have recently graduated, if you can land a job in the private sector, make sure you have a very good skill set, as it is a very competitive area. I hope you liked this video and it helped to answer some of your questions. Make sure you click the subscribe button and share it with your friends. In the next video, I will be discussing about the visa requirements and financial side of the ORE and LDS exams. I will also be giving you a very useful roadmap to get you through this exam and start practicing in UK as a dentist. I wish you all the very best.